is a nebuliser used for? Generally, our patients will inhale medications as part of their treatment to help clear the airways and relieve symptoms. Most commonly, this is administered via a handheld inhaler, which are just as effective as nebulizers. A nebuliser may be used in addition or alongside inhalers to treat symptoms such as wheezing or breathlessness, with bronchodilators, drugs that work by opening your airways. In an emergency, if you are struggling to breathe, this is something that you may have been given by a paramedic or hospital staff during an admission. Or to help control build-ups of phlegm and mucus, with solutions that work by loosening mucus in your airways, therefore making it easier to cough up. In some cases, antibiotics are also given via a nebuliser to treat and prevent infections. Only use the nebuliser to take the medicine prescribed for you.
So now we're going to show you how to set up and use your nebuliser. They will all look a little bit different depending on the manufacturer, but will consist mostly of a compressor unit that you need to plug into the wall. There'll be an on-off switch somewhere, which should be clearly to see, and a port to pop your nebuliser tubing in. Most of the nebuliser tubings will have the same ends at both ends, so you can attach them on there like that, and then you want to attach your medication chamber onto the other end. This is where you will squeeze in your nebules, and then you can attach either a mask or a mouthpiece depending on what you find more comfortable. The mask needs to sit comfortably over your nose and mouth and is secured with a piece of elastic. You can then adjust the tightness at the front to make sure you've got a good snug fit. With a mouthpiece, again, there is a medication chamber attached at the bottom that you can unscrew, pop your medication in, attach the mouthpiece, and then you can inhale the medication through your mouth. With both of them, you need to make sure that you're sat in a nice, comfortable, relaxed position, and that you just breathe in and out normally whilst you wait for your medication to fully compress through the nebuliser. You'll know that that's finished when the steam stops appearing, and you should see that your medication has completely run out of the chamber.
Cleaning and maintaining your nebuliser. It is really important that your nebuliser is maintained and kept clean, always following the instructions from the nebuliser manufacturer or healthcare professional who provided you with the machine. If you're using your nebuliser regularly, it needs to be cleaned and dried out thoroughly every day. Once you have finished your nebuliser, it is common for a small amount of solution to remain in the unit. This can crystallise and cause blockage if not cleared through. After each use, disconnect the mask or mouthpiece and chamber. Turn on the compressor for a short time to clear any moisture solution from the tubing. Wash the individual parts in warm soapy water. Rinse under hot running water to clear fine jet holes and leave to drain in a dry place, on top of kitchen roll in a small plastic container. It is essential that all parts of the nebuliser are completely dry before you put back together. Wipe over the machine weekly with a damp cloth, unplugging the machine before you do this. Top tips, and please remember, keep the compressor and neb machine on a firm surface. If kept on a carpet or floor, dust particles could be drawn into the machine. Parts such as mouthpiece, mask, tubing, chamber need to be changed regularly, at least every 3 to 4 months or following each infective exacerbation. Only use a nebuliser if you've been advised by a medical professional. If you have any questions or queries, please contact the team for advice.